And that's what most pelvic floor dysfunctions needs. If you have a prolapse, if you have incontinence or anything else, hypertonic pelvic floor, what happens with a hypertonic pelvic floor? Actually, if you have scar tissue in your pelvic floor, it's going to be very dense, like my hand here. Nothing can come inside here. No fluids, no circulation, no vitality. So we want to start to loosen these parts up. Otherwise, if we have these, and then we have the muscles around here somewhere, and we do the Kegels, we're going to create more tension here, because that's what we do when we do Kegels. And what finally happens is, if the muscles can't relax, that's a big problem, because, you wouldn't want to walk around with this arm completely tensed all the time. And then if you want to relax, it's going to be a lot harder to relax this if it's already like this all the time. So, you need to practice relaxation. You can do any kind of yoga or meditation or mindfulness that will create some calmness in your system, which is good for overall health, but especially for these tensed areas in the body. And especially for scar tissue. Scar tissue loves pressure and massage. Also, you can do scar tissue massage. You can use castor oil. It's amazing for scar tissue. So you apply lots of castor oil and you massage. And if you do it on yourself, it's very easy to feel, is this right for me? Is this okay? I mean, you're gonna have experience also not so nice feelings. That's fine. But if it hurts, if it's bad pain, maybe you should back off and just take a few breaths, creating this calm around your body, your nervous system, and your mind. So that's, this is just a few examples of what you can do to deal with pelvic floor dysfunction. And maybe you want to add Kegels later on. But what I believe, and many women who have healed alongside with me, is that we need to start to listen to our own bodies.